Miss Wright?
Stay right here. I'll be back in a little bit.
Okay. We're done with your PAP and HPV test. Since we did find some genital warts some months ago, I also took a look at the area that we treated, and it looks like a few small warts have come back.
What? They're back? How is that possible? I thought it was over. I finished the treatment, so I thought they were gone. I hadn't noticed anything. I never even told my boyfriend about the warts because I thought that was all over before we started dating. Oh. What if I've given them to him?
They can be hard to see, even for me. That's why I took a closer look. Even though you did treat the warts earlier, sometimes they come back. Remember that genital warts are caused by a virus, HPV. We treated you for the warts, not the virus.
I still have HPV. I thought that once the warts were gone, that was it.
Not necessarily. Remember, even though the warts are gone, the virus can still live in your body. There is no cure, but a healthy immune system is usually able to clear the virus.
I just assumed. What am I going to tell my boyfriend?
You can start by telling him that HPV is a very common virus. In fact, more than half of all sexually active adults will have HPV at some point. Many people never have symptoms, so they pass the virus along without knowing it. In fact, your boyfriend has probably had HPV or genital warts at some point too. Remember, Miss Wright, having HPV doesn't mean you did anything wrong.
Okay, so I didn't do anything wrong. But what am I going to tell my boyfriend? I hear what you're saying. I guess I should have told him about having HPV before now.
Well, it's certainly a good idea to talk about sexual health issues before becoming intimate. I always recommend that both partners get tested for sexually transmitted infections too.
You said that my immune system could clear up the virus. Should I repeat the HPV test in a few months to see if the virus is gone?
HPV tests like the one you had today are only used with a PAP test to check for high-risk types of HPV that are associated with cervical cancer. For women 30 and over, like you, doing these tests tells us which women are at greatest risk for cervical cancer. The types of HPV that cause genital warts are not the kind that cause cervical cancer. So having warts has nothing to do with cervical cancer. We don't know why some people's warts return and other people never know they have HPV.
Yeah, well, I guess we should have been using condoms all along.
Condoms are a great way to protect against sexually transmitted infections and unwanted pregnancies, but they can't totally eliminate the risk of HPV. HPV is transmitted through skin-to-skin contact and can infect areas not covered by a condom. It might help for both of you to learn more about HPV. Stop by our patient resources area and pick up some brochures that talk more about the facts of HPV. You can also visit this website, ashastd.org. There's a lot of good information and a section for partners.
HPV vaccines? What? Why didn't my doctor recommend this? I could have avoided all of this. Oh, I see. Vaccines are recommended for ages 9 to 26. I'm too old for that, but at least the kids can both get it. There are 2 vaccines available, and both are very effective at blocking the high-risk types found with most cervical cancer. One of the vaccines also protects against the low-risk types that cause most cases of genital warts. I'll call the pediatrician as soon as we get home. Okay, come on, kids.
When counseling a patient about HPV, here are a few important points to consider. Don't underestimate the emotional impact of an HPV diagnosis. Patients need to hear that HPV is a common virus that most sexually active people will come in contact with at some point. HPV can affect anyone, regardless of age, race, or gender, even sexual orientation. Transmission can occur with any genital or anal skin-to-skin contact. Since HPV-related diseases can take weeks, months, or even years to appear, they may be diagnosed even in long-term monogamous relationships. Make sure patients understand their diagnosis. There are different types of HPV, some which cause warts and others which are associated with cervical cancer. Remind women that regular screening is the best protection, and between the ages of 9 and 26, they can get one of 2 vaccines.